Assalamu alaikum. Am I audible? Okay. Assalamu alaikum, everyone. Welcome back to the third class of Core Foundations in the third Sahelites online research series. Let's start our today's session with the recitation of Holy Quran. And for that, I would like to invite Samila from first year.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الرحمن علم القرآن خلق الإنسان علمه البيان الشمس والقمر بحسبان والنجم والشجر يسجدان والسماء رفعها ووضع الميزان ألا تطغوا في الميزان وأقيموا الوزن بالقسط ولا تخسروا الميزان صدق الله العظيم.
Jazakallah for this beautiful recitation. Moving forward, it is my pleasure to introduce our speaker for today, Mr. Uzair Ahmed. He is a third year MBBS student at Sahiwal Medical College and he is also the acting vice president of RAS SLMC. He has actively contributed to various domains of research with experience in cross-section studies, qualitative and quantitative research, case reports, case studies, and the letters to the editors. We are delighted to have him with us today as he shares his insights on the critical analysis of a research article. It is an essential skill for interpreting and evaluating scientific evidence. I now invite Mr. Uzair Ahmed to take over the session. Over to you, Uzair. Uzair, please take over the session.
Gigi, I was actually my mic was off. Am I audible now?
Gigi, please continue.
Okay. So basically, critical analysis of a research article. This is our topic of discussion for today. So before we start our entire lecture, we need to understand what we going to gain from this lecture today. We are going to understand what critical analysis actually means and its importance. We are going to differentiate between literature review and critical analysis. So, literature review and critical analysis are closely related terms, but they are not the same thing. So, we need to assert and understand what they actually mean. And we will also evaluate each section of a research article. Basically, a research article has multiple components, and I will try my best to dissect each and every single one of the research article's component so we can get a better understanding how critical analysis actually operates when we are doing it in real world. We are going to identify the strengths, the weaknesses, and the biases of a research article. We're going to discuss all these terms in great detail. We are also going to discuss the validity, reliability, and applications of a research article. And also, we are going to draw evidence based conclusions from published literature. So, starting, I'm going to define critical analysis. The scientific definition of critical analysis is a systemic evaluation of a research article to determine its scientific quality, credibility, validity, relevance, and application. It involves questioning evidence rather than simply accepting conclusions. ये तो साइंटिफिक डेफिनेशन होगी इसकी. अगर मैं आसान अल्फाज में कहूँ तो बेसिकली इट इज द एनाटॉमिकल डायसेक्शन ऑफ अ रिसर्च आर्टिकल. Basically, we need to understand that every published article is not necessarily a good one. What does that mean? Basically, there are good researches that are published and there are bad researches. The main purpose of critical analysis is that we can ourselves identify the difference between a good research and a bad published research. So we only use the good research as a reference for our original article. So that's why critical analysis is important. For example, let's say a student says this herbal medicine cures headache in 5 minutes. What should we ask? We should ask, what is the sample size of this study? What was the method of this study? What was the control group? Was there a placebo involved? What was the measurement method? And many more questions. These all questions lie in critical analysis. We are going to discuss all these questions later on in quite much detail. So why is critical analysis important? It supports evidence-based practice. Basically, we know that research is itself systemic evaluation, which means we do not just accept things, we critically analyze everything. We ask questions, whys, hows, and wheres. And these are the questions that are extremely important. And critical analysis is basically asking those questions for an already published article. So we are asking why this research exists, what it is answering, and many more questions. It prevents acceptance of flawed conclusions. What does that mean? It means that often, let's say there's a journal, it publishes research, it lies in the Z category. According to HSC, there are different categories of different journals. Now the Z category lies in the bottom hole. So what happens is that for their financial gains, they often publish articles that do not stand good that do not add to the research pool, or perhaps they are giving advantage to a pharmaceutical company, and the article has a different result and its conclusion is different. So it is important when we are ourselves as doctors and as future scientists and researchers are reading that article, we can differentiate whether this is a good research and it is following all the methods and patterns of research, or whether it is biased. It is supporting something, but it is saying something and it does not support it with true facts and evidences. It should improve research literacy. It helps us identify bias and methodological errors and guides clinical and policy decisions. So basically, what does identifying bias means? Basically, we are going to discuss all the different types of bias that are present. Usually, bias means that we are hiding something or we are not saying something in clear wording. For example, there's a pharmaceutical company, they did a research on their drug, but when the results came, it shows that the pharmaceutical company in its conclusion says this drug cures cancer, but in the results there is written it helps or it only cures 0.05% of the cancer. So saying that it completely cures a cancer in the conclusion is wrong. We cannot say that. So that is the difference between a good research and a bad research. Good research does not say anything for sure. It always says association or prevalence, whereas a bad research tries to assert itself, saying this thing does this 100%. Whereas we know that facts often are not 100%. Even when we are collecting data, we only take 95% confidence interval. So we need to understand what is the difference between literature review and critical analysis. Yesterday, Ms. Ayat described literature review quite in detail. Basically, literature review is just reading the article, whereas critical analysis is evaluating that contents of that article. What does that actually mean? I can state it like that. Okay, we can say that reading literature review is reading, whereas critical analysis is understanding what the article is stating. अगर हम आसान अल्फाज में कहें तो लिटरेचर रिव्यू इज लाइक कि आर्टिकल कह क्या रहा है, और क्रिटिकल एनालिसिस इज लाइक कि वो जो कह रहा है वो कितनी सच्चाई के साथ कह रहा है या कितने अच्छे तरीके से कह रहा है, या हम इस पे कितना यकीन कर सकते हैं कि जो वो कह रहा है. So literature review is a passive process, whereas critical analysis is an active process. We have to actively ask ourselves question okay, whether this portion of research article is saying something. Is it saying actually which supported by facts, or does it just saying this thing without facts or evidence? We always make sure that there are evidence and facts attached and we understand them. So, what is the framework for appraisal? What we have to do to actually critically analyze what are the main parts of critical analysis. We need to ask ourselves three main questions. Is it true? Evaluate validity and methodological quality. Let's take an example. A study claims coffee reduces depression, but includes only 10 students without any control group. So, is it ensuring the validity and methodological quality? Obviously, no, because we are only in this study, we are only doing it on 10 students. So it will not hold true. Why? Because the research group or the population size is way too small. And this is just the case group. We need also to have a control group to understand whether coffee actually reduces depression or not. So it is an unreliable research. Therefore, whenever we are studying a research paper, we need to ask ourselves the first question: what the research article is actually saying. Is it true? What are the results? Are they actually findings or rather just interpretations? For that, we understand the percentages, p-values, and mean differences. Now, sometimes a published article, we know that when p-value is less than 0.05, it is significant. We all know that. Sometimes a published article has these different figures available in it, in which p-value is less than 0.05. But what happens is that zero point zero 0.05 less than shows that it is significant. But we need to understand whether that value is statistically significant or clinically significant. When we read the entire result, we came across the fact. For example, we take a drug. A pharmaceutical company created a drug, and they say that this specific drug reduces the blood pressure of a human being by 2 mmHg. Now, the p-value will come less than 0.05. So it is statistically significant. But we know that if we are trying to give that drug to to hypertensive patients as an antihypertensive drug, we cannot use it. Why? Because 5 mmHg of blood pressure change will not hold clinically significant. So, when are we studying the results? We need to assess the magnitude and significance of findings, whether the findings actually are clinically significant or not. This is the exact difference between a good article and a bad article. And next is, can I use it? For example, a study was conducted on US students, United States of America. Their demographics, their environment is widely different. So, if let's say I'm making a research paper on a population in our own country, I cannot use that specific study in its entirety. Why? Because the demographics of US students, sleep, whatever the study is on, perhaps it's on sleep or in academic or their hostel life, is very different from the students in Pakistan, because both the countries have varying geographic dynamics, and also the lifestyles of both the students will greatly differ. So I should ask myself when I'm critically analyzing an article, can I use it in its entirety? Whenever you are doing a research on any topic, try to find the most closely associated same condition, geographical condition article. So next we know that an article, research article, has different portions. It has a title, it has abstract, introduction, and so on. So we should evaluate and critically analyze each and every portion of the research article. अगर मैं आसान लफ्जों में कहूँ तो it is like an anatomical dissection and then under microscope examination of each and every part of the research article. So when I am observing a research article, what is the first thing I see? Obviously, the title of the research article is the first thing I see about the research article. So being a good researcher or being an aspirant researcher, I must understand what a good titles look like and what a bad title looks like. So I can evaluate the article in just in the start. So what does a good title sounds like? Basically, it should be clear, specific, and descriptive. Now understand that with the example. I will give you an example of a bad title and a good title so you can understand the difference. A good title will sound like Prevalence of Anxiety Among Medical Students in Sahiwal Medical College, Punjab, Pakistan. As you can see, not only this title is clear, it's concise, it is informative, and it reflects almost the entire thing. It is a prevalent study, aka a cross-section study. It is studying anxiety among medical students. It has specified the population it is being targeted on, and all the right questions are being mentioned in that title. Whereas a bad title will sound like Amazing Effects of Sleep on Life. Now, this is not a good title. Amazing Effects of Sleep on Life. It is neither justifying what it is, it is not clear about its objective, it is not clear about its population size, and it's also not clear where it is actually happening. Which type of, we are studying effect of sleep on life on whom? Or we are just generally studying on. It is not even specifying whether it is being done on human beings or not. So it is exaggerated, unscientific statement. We do not want titles like this. If you ever see a title like this, like Amazing Effect to Sleep on Life, medical students are depressed, these are bad titles. Good titles will sound like something prevalence of anxiety among med students or association between screen time and sleep quality in undergraduate students. These are the examples of good titles. Now, I- let's get back towards such article. I have seen the title. Let's say it was a good title. Now I'm interested in this research article. I will click it. I will click it, and the entire article will be available to me in a PDF form. Now, the next thing that would be present on the article, on the research article, is the abstract of the research article. Now, why studying the abstract is important? Because abstract is basically summarizing everything which is present in the actual article. So, what are the main points of the abstract? We need to make sure that the abstract is consistent with the main text. If the abstract is claiming something in its results, the actual result should support that. So we need to understand, we read the abstract. Let's say there is an article who says in abstract that this specific thing cures or reduces blood pressure significantly. But in the it cures hypertension. But in the results, we came across the fact, the actual results, that it is only reducing the BP by 20 to 30 mmHg. Now, the results in the abstract are not actually true. Why? Because 20 to 30 mmHg cannot be a statement for actually curing hypertension. It can help in curing hypertension, but it is not a definitive statement. So you need to understand whether the abstract is consistent with the main text or the main article. Now, introduction. What does a good introduction sound like? So a good introduction has certain points. Whenever you are studying an introduction, you should keep those points in your mind. It should give a background of existing knowledge. Let's say there is an article on AI. It should give you a brief information what AI actually is. You see, every article present on Google Scholar, whether it is any type of research, if it is an intro, that introduction will surely have explanation of that term even if you know that term. Let's say, for example, there is an article explaining fever or association with fever is something. We all know what fever is, but in the introduction, you will actually find the definition of basic wording to describe what fever is. So, moving on, a good introduction will have mentioning of the clear research gap, justification for that particular study you are going to do, or why they did that study. and final objective statement. Okay. Now, next we have, let's say I'm moving on the article further. What we have then? We have the study design and the sampling. Basically, these all things fall under the heading of methodology. Now, what we have studied in the first lecture of this series by Dr. Maidal too, what different types of study designs look like and why we use which one. So basically, whenever you are studying an article, make sure that that specific article is actually following the right study design. For example, they are studying the prevalence of headache among medical students, let's say. So it is supposed to be a cross-sectional study. But let's say in the study design, in the methodology section, they are saying it is a case control. It is not a case control because we are studying the prevalence of headache among medical students. But if they are saying a different type of, let's say they are saying something like this specific thing causes my drug treats someone. Now, this specific drug treats someone, we will make two groups. One will be case, one will be control. We will give in one case, in other case, we know. Then it is a RCT, then is checking the drug effectiveness. So basically, we need to understand different study designs in clear detail so we can actually answer ourselves. We can ask the question and answer ourselves whether this specific study or paper we are actually reading is following the right study design. Along with that, population and sampling. This is very important. Now, often, what does it mean basically? Whenever we are going to do a research, we calculate a sample size. Now, why it is important to calculate a sample size? Why don't we just go randomly in a college, in a medical college? Let's say we are doing a research and do it. Obviously, it will cause error. Why? Because we know that if we do this sampling and not enough people are made part of the research, then our associations, our prevalence are not representing the entire population. Our research, if it is in under, let's say, research is targeted on the medical students of Sahiwal Medical College, then it should represent the entire population. But the problem is we cannot go to each and every single individual. So what we do, we have scientific methods to calculate a specific number of people from the entire population. That if we get this many forms filled, it will be a representation of the entire population. So the population size for each and every study should be strong enough so it can actually present the target population in a good manner. So next is sampling method. Now, sampling method should minimize always selection bias. What does that mean? Selection bias. What does that term specifically mean? Selection bias means, let's say, I want to conduct a study. I am a first year MBBS student and I want to conduct a study to study the prevalence of headache and association with academic performance. I make a questionnaire and get it filled with everyone present in my class. Why would they fill it? Because they are my class fellows. It would be easy to get them to fill that form. Now, I don't want to go and beg everyone else in other medical students in other classes to please fill this form. So I just make my study proportionate to just got the forms filled just by first year. But in my research title or in my methodology, I am stating that this article or this study of mine is representing the entire population of Sahiwal Medical College. That would be wrong because I, for my convenience, only took the questionnaires from the first year because I was part of first year. But that does not represent the entire civil medical population, students population. So we need to understand when we are studying an article, what type of population size what is the population size, and what sampling method was used, whether it's convenient sampling, non-convenient sampling, or randomized sampling. Always remember that randomized sampling is the best kind of sampling. We have studied all the different types of sampling in the first lecture of this specific series. If you remember that, please remember that entire thing when you're actually critically analyzing a research article. Now, next are the variables, the data collections, and the ethics. We will start from bottom, ethical consideration, because that is the easier part among the other two. Ethical consideration. Now, I conducted a research. For example, it is about a drug effect on patients. but I never got approval from the board, from the IRB, Institution Review Board. So I conducted my research, and the research never got. That's a for example, research even got published. But later on, when someone else was studying my research, they came across the fact that the ethical letter, you could not find that ethical letter. Then that this is an ethical dilemma in research. Whenever we are doing a research, we have to make sure that all the ethical considerations are met for that specific research. Uh, First of all, it is very difficult for an unethical research to get published in the first place by an actual journal. But let's say by a fluke luck, it got published. It is the duty of every other researcher to bring in the notice of that specific journal. That's why entire type of study, which we term as LTEs, letter to editors, exist. Basically, we observe different and thousands of different articles published each and every day, and we find mistakes in them and then write those mistakes. So, how we're finding those mistakes? Obviously, we're finding them by critically analyzing that specific article. Now, why variables are important? Basically, every research has at least three kind of variables: independent variables, dependent variables, and confounding variables. I mentioned just two: independent and dependent, because these are the ones that are visible to in the research. Independent variables are the ones that are the cause. We can say it like that. For example, study hours, screen time, or caffeine intake in a research. What are the dependent variables? Which are the outcomes measured. For example, I was studying the number of study hours and the sleep quality of a student. In this case, the study hours will be independent, and the dependent variable will be sleep quality. So whenever I am critically analyzing a research article, I must understand the difference between different variables. So when basically variables affect your analysis of a data in the SDS greatly. Your research can change from A to B in a matter of seconds if you do not take heed in your variables. So you need to understand all the variables present in your research greatly or brilliantly. So there are third type of variables which are termed as confounding variables. I have not mentioned them here because the confounding variables are actually the hidden variables, the variables that are actually affecting your research as well. For example, I was conducting a research on cardiovascular disorders, and I mentioned and research stated that it was a study between association between smoking and cardiovascular disorders. Now, the problem is that cardiovascular disorders, smoking is not the only cause of cardiovascular disorders. We need to consider the age. We need to consider the other confounding variables such as obesity of the patient or other chronic conditions of the patient. So the variables that are actually we are that are not actually part of our research but affect our research fall in these confounding variables. In simpler words, we can say confounding variables are the hidden variables. So whenever we are critically analyzing an article, we need in the section and in the methodology section, we need to understand that all the variables mentioned does this researcher have mentioned both the independent variables and dependent variables? Because if he hasn't, then surely this data would be flawed somewhere. Now, apart from that, we have data collection tools. So we know that whenever we are doing a research, let's say most common type of research in our college is cross-section research. Now, when we are doing the cross-section research, what is the main part of the cross-section research? It is a questionnaire. Now, it is important where the researcher got that questionnaire from. Is it a pre-validated questionnaire? Is the researcher created that questionnaire himself? It is important because if the researcher has created the questionnaire himself, then he should get all the questions validated by an actual board in your institute. If not, then the questionnaires integrity in the determining that specific prevalence would be wrong. Let's say I was calculating prevalence of depression among medical students. Now, what type of questionnaire tool would I be using? There is an internationally WHO recommended scale which we use, which is known as PHQ-9, which is used to determine the level of depression among medical students. I cannot just simply ask questions which I feel like. I should ask the questions that are validated by international board to determine depression. Now, next thing, we have bias. We have mentioned bias so many times. What does bias actually mean? Basically, there are different types of bias, and in a research paper, a small amount of bias always exists, especially at our level. Especially in cross-section research, there's always a bias because we are often using convenience sampling. We are So there is a selection bias. This is the most common type of bias actually, selection bias. We are using convenience sampling. Let's say, for example, we are conducting a research in undergraduate students, but the problem is I cannot get access to all the undergrad students. So what I do, I change the title of my article and narrow it down to Sahiwal Medical College. And even in that, you will often see if a research is being conducted by a third year MBBS student, then his articles population size has a majority of third year students. Also, other students would be present, but their number would be low as compared to third year MBBS. Why? Because it was easy for him to get those forms filled by his own classmates. So it is a selection bias. Now, next type of bias is information bias. What does that mean? Information bias means that the measurements or the data that measurements that the questionnaire we used, we didn't use that exactly. So as a result, when we are using it, when we calculated the entire data, there was some error that the researcher missed, the publisher missed, but that is now clearly visible for you. Now, what is recall bias? Let's say I was conducting a research on medical students to evaluate their academic performance and effect of sleep quality before a block exam, number of sleep hours. I conducted the research after the result was announced, probably 1 week after the exam. Now, after 1 week, when I'm conducting the research, the students have to recall how many hours they sleep before their examination day. So the problem is that most students might have forgot how many hours they actually slept. So that is a recall bias. It is basically the type of error which occurs due to memory, I could say. Now, observer bias. Basically, researcher influences interpretation. Let's say I'm a researcher and I'm expecting high stress among medical students because I myself is a medical student. I know there is a lot of stress in our field. So I was expecting high stress among medical students. So when I was calculating and evaluating my data, unknowingly, I was actually also, you can say, engineering it. So the result says that yes, there is high stress among medical students. So my belief models, researchers' belief models can actually affect the research. So when we are studying, let's say, article, we need to understand these different type of biases. Although there are always bias present, but if they are so large that they are actually affecting the result significantly, then we must be trained enough to not only identify those biases, but actually point them out. Now, what is the validity? Our research have two kind of validities, internal validity and external validity. What is internal validity? Everything we have mentioned till this point is internal validity. That the method the research is okay, is right. The questionnaire it uses is right, and everything else like the methodology, population size, everything. It is internal validity of the research article. What is the external validity? External validity means can the results be generalized? Are they reproducible? Let's say a study was conducted among the medical students in Sahiwal Medical College. Can this study be replicated among the medical students of Gujranwala Medical College? How would we do that? We basically take the same sample size and conduct a study. The results are same. That means that the original research is also externally validated. Often the published researches are externally validated, means their results are reproducible if under the same circumstance, if they are reproduced in the same under the same circumstance. If the circumstances change, then they are not externally validated. For example, a research conducted in US will not be externally validated in a country like Pakistan. Why? Because the demographics and conditions vary greatly in Pakistan and US. Next, there are the results and statistics. We need to evaluate the results and statistics portion of the research article to critically analyze whether the text, tables, and figures mentioned are correct. Sometimes there might be a typing error. Sometimes the p values are not significant, but they have mentioned it that they are significant. So we need to understand that. Along with that, often in the result section, they always mention, the researcher mentions what type of research he actually ran. Whether it is a chi-square test or some other correspondence test, so picture test. So we need to understand as a researcher, if we have that much grip on SPSS, we need to understand whether the test they have ran in this research and the result they got from it, can that specific test actually produce that result? For example, chi-square test can only run on two quantitative variables. So, sorry, two qualitative variables. It can't run on quantitative variables. So, if you have two quantitative variables, then if the researcher has mentioned that I have ran a chi-square test, then he's saying the wrong thing. So we can mention it and we can point it out. Now, there's an important point here. Statistically significant does not always mean clinically significant. Why it is important? Although it is not important on literature basis, but it is important in our clinical life. Because let's say we want to treat hypertension or any disease, and there is a drug in the market, new drug in the market. It has different research articles attached to it. The pharmaceutical company approaches me that please use our drug for this specific treatment of the disease. As a doctor, it is my job to study the results of that specific drug before introducing that drugs to my patients. So it is important I observe the statistical significance and clinical significance. What does that mean? A drug lowers the BP by 5 mmHg. I have already given that example. It is statistically significant. Yes, the drug is actually lowering blood pressure, but it is not clinically significant. I cannot give that drug to hypertensive patients as an anti-hypertensive drug. Why I cannot give it? Because 5 mmHg is not significant decrease in blood pressure. So, as a researcher, as a doctor, critical analysis is important. Next, we have interpreting the discussion. So, a strong discussion should interpret findings logically. There should not be anything that is illogical, that is not supported by evidence. It should compare results with previous studies. Let's say there were two studies conducted in different portions of the world. The original study stated that there is hypertension among medical students, more prevalent, or in old age. And the other study also does not say that. Let's say for any reason, let's say their population size was small. So the study which was conducted later on should mention it that most researchers says that hypertension exists in old age, but our study does not say that. It fell short due to some reasons. And it also should mention that why our results may vary from the original or already published researches. Apart from that, we have to consider alternative explanation, confoundings, avoid claiming causation from observational data, and provide balanced recommendation based on evidence. Next, we have strengths, limitations, and applicability. While critically analyzing, we must understand each and every article's strengths. What are the strengths of the specific article we are studying? Why it is important? Basically, I would always advise all the new aspiring researchers, whenever you are critically analyzing different research articles to be used as reference for your study, always make a table of all the studies. And when you're making that table, always mention the strengths and limitations of each and every single study. Why it helps? Because it helps you to find that research gap. Because if you know the strengths and if you know the limitation, then you can find the difference between your study and the already published literature. So basically, the strengths usually sound like large sample size, multi-center design, and robust methodology. And what are the weaknesses? Just turn it opposite. It had a small sample size. There was a lot of biases. It was not multi-center. It was pointed at a single center, a single point. And not only that, it has missing data. Its methodology was not correct. Perhaps it was a cross-sectional research, but they are mentioning it as a case study or case control. It is wrong. We need to understand the different types of methodologies and different types of study designs, and we need to see that the specific published article is following the right thing. Applicability. Consider whether the findings are relevant to your patient settings or population. A study conducted in US is not okay for the students or the population in Pakistan. Next, we have what are the final appraisal or checklist. Basically, we need to ask ourselves certain questions. It is basically, I have mentioned all these things in the entire lecture, and now we are just check boxing, ticking each and every single box whenever we are critically analyzing a research article ourselves. The first question we should ask is whether the search question is clear. Is the study design appropriate? Is the sample size adequate? Is bias minimized? We cannot remove bias truly, but we can minimize it to such extent that it does not affect our result so greatly that it changes it. Now, are statistics correct? Do conclusion match result? The main point, the main tick of on the entire conversation. If you are not looking for the entire critical analysis of an article, always make sure just one thing that the result matches the conclusion, or the result or the conclusion is supported by data. This is the main point because each and every single article must be looked and critically analyzed through this specific point. It is like the main necessity. Are the results applicable to your research or to your practice? Now, we have critical analysis. Key takeaways. We have mentioned all these. We have defined what critical analysis is, how we do critical analysis of each and every single portion, and what are the questions we should ask in each and every single portion. So, a good researcher asks not only what does this research say, but also how much should I trust it? It is really important we ask ourselves this question. There's a quote actually. Research is not truth itself, but a structured attempt to approach truth. Every paper is a claim, not a conclusion. A critical thinker does not ask only what is written, but whether it deserves to be believed. So, dear researchers, aspiring researchers, please keep in mind you're critically analyzing not only published articles for your own sake, but also to make sure that the bad articles, the weak researches are eliminated from the system. So, guys, I'm going to take questions. Please, if anyone has any questions, mention them in the comments. I will try to answer all of them. Guys, anyone has any questions? Okay. Which variable is dependent and which is independent variable? So basically, variable dependents are often the ones which are not greatly affected. For example, they are the cause. They are not affected mainly. Like if we are doing a research on sleep. Now, number of sleep hours is an independent variable, whereas a dependent variable would be sleep quality. Because we are doing a research on, let's say, depression effect on sleep quality. So, number of sleep hours, it is not affected by depression, but the sleep quality would be affected by the depression. So, this is a difference between a dependent and independent variable. So what is case study? Okay, so the answer to this question is case study is basically we take a clinical case and mention the findings of that specific case. We can take more than one individual. If it is one individual, it is a case report. If you have series of case reports, then it becomes a case study. Is good website like PubMed is proof of trustworthy article? Okay, so this is a very important question. Is good website like PubMed is proof of trustworthy articles? Both PubMed and Google Scholars are like open databases for all the journals. They do not filter bad researches from the journals. Each and every journal which has access has bought to Google Scholar or PubMed can get their researches there. PubMed and Google Scholar does not filter them out. So a research being present on Google Scholar or PubMed does not necessarily mean that it is a good research. It can be a bad research. How it still got there? It can happen in three ways. The publisher got a financial benefit, or perhaps the publisher skipped it unintentionally, or perhaps there is some magic that was involved in the publishing of a specific article. Okay, how do you measure clinical significance of an article? So to measure the we often measure clinical significance often in case of clinical studies, case control studies, and RCTs, randomized controlled trials. Often it involves drugs. So whenever there is a new drug mentioned, old drugs are already about them. But whenever there is a new drug which is not mentioned in your book, it is quite new. Then what you have to do is you need to understand what it is doing and they are claiming that it is doing and what is it actually doing. So you need to compare both what is actually doing and what they are claiming it to do. If both matches, then we know it is clinically significant. And we evaluate the side effects. We evaluate whether it is producing the same effect at the same level they are saying. Okay, next is observer bias. Okay, so basically, it is asked how we can identify observer bias, how researchers influences interpretation. Basically, it depends upon the researcher, but you can easily identify it. Let's say the study is saying there is a study conducted, it involved 122 20 students, 60 students, and we are evaluating sleep quality and let's say their emotional stability and academic score. And we observe their academic scores and their uh, mental stability through international scale. And the researcher has already established in his mind that the student scoring high will have greater mental stability as compared to others. So when he's mentioning everything, he basically when he's analyzing the data, he engineers it himself to match that result. But it would be clear because he has to provide that data as well. In the C values, he can make the changes, or in the result section, he can make the changes, or perhaps in the result on the figures, it is written correctly but in the conclusion he is saying something else which is not supported by the data. So in this way you can identify observer bias. But as I mentioned, the bias exists in each and every single of the articles. The only thing that is that it should not exist so much that it affects the article in its entirety. It results in its entirety. Are there any new messages? Uh, Okay, so it is asked that there are several tests and methods to collect empirical data in a research. Usually, the journal does it for you, but you can identify that there's always an HEC recognized list of journals. If you're studying an article and if you want to take it as a reference in your article, original research, check its validity of that specific journal. There are some journals that are like JUMDC or NIMC. These are well-known and established articles, so we can use their published articles without any specific, uh, you can say, bias or questioning. But as you mentioned, there are different clinical. When you master the SPSS, you can find out, you can get used to it. You know that this specific test cannot be used here. You just know it when you know SPSS. So that is how you know that which test and methods to collect empirical data. Uh, so the last question is what is internal bias? So internal bias is basically the same as observer bias that researcher influences the interpretation. Any other questions? Guys, any other questions? Anyone? I think the questions are done. Okay, what is internal bias? Multi-center study means. Multi-center study means that a research is being conducted at several, let's say there is a research being conducted in a single medical college. It is a single-centered study. If it is being conducted at multiple points, let's say in multiple colleges at the same time, then it is a multi-centered study. In other words, a study that is being conducted at many folds at the same time, it is considered a multi-center study And why it is important and better than a single-centered study? Because multi-center study is giving you a bigger population size. When you have bigger population size, you can establish what you're establishing with stronger evidence. And whenever you have stronger evidence, it means you can your research has less chance of getting rejected. Any other questions? Thank you very much, everyone, for your time. I think the questions have ended. Thank you very much, everyone, for your time. Thank you for being here. I hope the concepts are clear, and I hope you do the critical analysis of an article yourself. Thank you very much. Thank you very much.